Now we get to look at some characteristic X-ray features, and this is what is known as thin ribs with multiple fractures and beaded appearance. Okay, thin ribs with multiple fractures and beaded appearance. So what we have is basically, this feature. Okay, if you look at the next X-ray, it's much more nice. You can see that the ribs are thin and they have some rounded stuff. That's the beads there. Okay, so it's actually a classic radiographic description. It's often associated with osteogenesis imperfecta. Okay, so thin ribs just is due to the defective collagen formation, and the bones are fragile and under mineralized. So the ribs usually appear slender on X-rays. So multiple fractures is because the bones are so weak, so you can see many places are broken. Okay. Beaded appearance, there's some alternating pattern of healed fractures. So there's callus formation outside the joint. So it's now giving it a beaded or rosary-like look. Okay. So context is associated with osteogenesis imperfecta, where collagen synthesis is reduced. So the bone is fragile, the fractures are frequent, the person's sclera is blue, there's hearing loss, there's dental abnormalities. So there's thin bones, a lot of fractures, beaded ribs, and Woolmian bones in the skull. So differential diagnosis, you can also be suspecting for rickets, where you're seeing the rachitic rosaries, but that's different. Okay, it's due to cartilage overgrowth and not fractures. So that's what we got for thin ribs with multiple fractures.